Good morning. Good morning, good morning, good morning. We're talking about the anatomy of word construction, okay? Coming from the Essentials of Medical Language, the second edition, Allen and Locker, all right? So we're talking about the anatomy of word construction. Good morning. We're talking about Chapter 1, the anatomy of word construction from the book Essentials of Medical Language, the second edition, Allen and Locker. The learning outcomes for this particular chapter has 6 learning outcomes that we're going to discuss. We're going to discuss identifying the root, combining vowels, and combining forms of medical terms. We're also going to discuss, number 2, understand the importance of suffixes and prefixes. It's important to understand where medical language has its origin from, or the genesis, or where did it begin. Please understand medical language has been developed from both Greek and Latin root words. So this first learning outcome that we're going to cover today, right now in Chapter 1, is the construction of medical words. So that means building up, okay, building the medical word, and that also means understanding how it is built, okay? And so the first outcome that we're going to discuss in lesson 1.1 is build and construct medical terms using their elements. The second is we want to select and identify the meaning of the root of essential medical terms. Root. Think of a root. What is a root? A root, think of a root of a tree, okay? Gives it the foundation and the actual meaning of the word. Okay, the third part of Chapter 1, construction medical terms, medical words, is define the element combining vowel and combining form. In this outcome, think of the word two words, house and boat. These particular 2 words joined together as houseboat gives a new meaning. We're combining these, okay? But when we think of medical terms in the concept combining vowel and combining form, think of peanut butter and jelly. That combining form and, okay, makes that sandwich together, okay, as an example. Moving on here to the fourth outcome, identifying the combining vowel and the combining form of essential medical terms. Okay, here's a word, pneumothorax. You're going to learn what the root word pneumo means, and then another root word, thorax. But the combining vowel there is the O, pneumothorax. These 2 root words, so pneumo and thorax, joined by combining vowel, pneumothorax. You're going to understand those concepts and apply them. The fifth outcome is define the element of suffix and prefix, okay? The suffix is at the end of the word, and prefix is at the beginning of the word. So moving on to learning outcome 6, you are going to select and identify the meaning of the suffixes and the prefixes of essential medical terms. These are very, very important that you understand and you're able to identify and apply when you are taking a look at each of the words. To understand medical language, class, you must first become familiar with the elements of medical terms. So what is a root? Okay? A root is the foundation of the word. It is the base of the word which gives the word its meaning. Okay? Some words simply begin with root, as does pneumonia. Okay? Some words have more than one root. Alright? Like the example I gave in the previous slide, pneumothorax. Those are two roots. Okay? All medical terms have one or more roots. Okay? The root does provide the meaning of the word. And in this example, the word pneumonia has the root pneumon. Okay? And that root means lung or air. So what is a combining vowel? A combining vowel joins a root to another root or a root to a suffix. Okay? Here, bullet point number 1. Roots are often joined to other elements of a medical term by placing a combining vowel on the end of the root. Take a look at the bullet point number 2, the second bullet point. A root plus combining vowel creates a combining form. Example, noom, P-N-E-U-M plus O, noom/O, okay? A combining vowel is like a bridge that connects the main roots together. A combining vowel simply makes the word easier to pronounce. The example I gave earlier, pneumothorax. That combining vowel simply connects the two roots together, making the word easier to pronounce. So next, what is a combining form? A combining form is a combination of a root word and a combining vowel. These combining forms help glue roots together, and they can also come before a suffix. So hold up, what is a suffix? A suffix is the ending of a word. And I want you to understand that not all medical terms have suffixes. Many words simply end with the root element, okay? A suffix going outside of medical terminology is identification. The suffix on that particular word identification is ION. And that suffix ION means the process of. So when we combine that suffix to the word identified, that means the process of identifying. Okay? Here is the example that I was sharing earlier, pneumothorax. Okay? Take a look up top here. You have the word pneum and pulmon. Okay? In the word pneumothorax, we would spell that Pneumothorax. Okay? Here is the spelling of pneumo with the combining form. Pneum/O. Okay? Is up there at the top on the right side. Okay? That's the combining vowel. There's no combining form on the word up top at pneumo, okay? On the left, you see pneum, P-N-E-U-M on the left. That's the root. The combining vowel there, okay, is in the middle, just the O, and then on the right, they put the slash there to combine it, okay? Pneumo is the combining form, meaning lung or air. When you add the word thorax, that is the root meaning chest. So what does pneumothorax mean? Pneumothorax means air in the chest. O is simply the combining vowel. Okay? And I want you to understand something as well as to remember, O is the most commonly used combining vowel. Okay? Let's take a look at the second example on the slide there. Pulmon. Okay? Think of pulmonology here. Okay? Right there, you see pulmon on the left is the root. In the middle is O, and on the right is pulmon/O. These are examples of showing you combining vowels. Pulmon also means similar to pneumon, okay, is pulmon with the /O is the combining form meaning lung or air, and LOGY as the suffix means study up. So when we combine pulmon with an O and the suffix LOGY, that means pulmonology. Pulmonology then means the study of the lung. The study of the lung. So Pulmonologist, as another example, pulmonologist, that suffix changes to IST, then that means a person that studies pulmonology. This slide here wants you to understand that different roots also can have the same meaning, just like the previous slide. Pulmon and pulmon both mean lung, okay? But now I want you to understand that altering the pronunciation or spelling of the word can dramatically change the meaning, okay? So many medical terms sound similar. So therefore, spelling must be precise and the correct pronunciation must be used. Please understand how important this is. A misspelling or mispronunciation could alter the treatment and medication prescribed to a patient, resulting in injury or death. This is very important. So now let's talk about suffix. I think really suffix is really very, very important because once you identify the root word, the suffix really makes it tighter, makes the understanding of the word that much more tighter and clear, okay? So a suffix is found at the end of a medical term. It can be attached to a root element or a combining form, okay? Okay, which would give it a new meaning, okay? A suffix is an element added to the end of a root or combining form to give it a new meaning, okay? Now, if a suffix begins with a consonant, it must be followed by a combining vowel, okay? For example, the word dermatitis, D-E-R-M-A-T-I-T-I-S, dermatitis. The suffix the suffix I-T-I-S begins with a vowel. So no combining vowel will be needed, okay? Because the suffix is itis, and there's no combining vowel that is needed with that particular example. Now, if the suffix begins with a consonant, it must follow a combining vowel, okay? So here, if a suffix, so the example here is the word dermatologist, okay, dermatologist, okay, D-E-R-M-A-T/O is the combining form, okay, combining form, and then you have the suffix L-O-G-I-S-T is the suffix. So to make the word complete, you must add a combining vowel of O, okay, which is needed between the root and the suffix, okay, which begin with a consonant. Sometimes a word can also have two suffixes. So if the suffix begins with a vowel, no combining vowel is needed, okay? Here's an example here, pulmonary, okay? The root there is pulmon, P-U-L-M-O-N, and there's the suffix, A-R-Y. Pulmonary, okay? The suffix A-R-Y means pertaining to the lung, okay? So with the word pulmonary, the suffix, again, A-R-Y begins with a vowel. So no combining vowel is needed. So understand that, okay? The suffix there begins with the vowel, A. Okay, what are the vowels? A, E, I, O, and U, sometimes Y. Okay? So if the suffix has a vowel at the beginning, and the root word in the term up here, pulmon, you do not need to have a combining vowel. Pulmonary means pertaining to the lungs. Okay? Then the next example there is pulmonology. You see this one? If a suffix begins with a consonant. In the word pulmonology, the suffix is L-O-G-Y. Okay? That begins with a consonant, L. So to make the word complete, we must add the combining vowel of O, okay, between the root and suffix to make the word pulmonology. Okay? Pulmonology means the study of the lungs. The suffix itself, logy, means the study of. Continuing on with the study of the suffix, okay, what is found at the end of the medical term. This here on the slide here, IA means a condition of. Okay, we understand if a suffix starts with a vowel, then no combining vowel is needed. For example, the word pneumonia. The suffix here, IA, begins with a vowel, so as we said again, no combining vowel is needed. And the same is with the word beneath there, respiration. The suffix ation begins with a vowel, so no combining form is needed. Okay? And we understand pneumonia up top means a condition of the lung. Okay? And with the second word, respiration, ation, we understand that means a process of breathing. Now we are at the beginning of the word, all right? So we looked at constructing medical terms from looking at the root word, then the suffix at the end of the word, also to combine these words, okay? So now we're going to the beginning of the medical term, which is called the prefix. The prefix is found at the beginning of the medical term, and it gives a new meaning to the root word that follows the prefix. A prefix is an element added to the beginning of a root or combining form to continue to expand the meaning of medical terms. Understand, prefixes will never require combining vowel, and also understand that not every term has a prefix. Okay? Here's an example. Pericardium and epigastric do not require the use of a combining vowel at the end. Okay? Occasionally, a term may have two prefixes. Okay? Here is an example of the word premature and postmature. As we said, a prefix is found at the beginning of the medical term. So here, P-R-E, plus the root word mature, okay? Premature before the normal pregnancy, and postmature, right? Prefix is post here, and mature, two of the same root words. Mature, two different prefixes, which means two different meanings of the word. Premature before the normal pregnancy, post-mature after the normal pregnancy. Prefixes are located at the beginning of a medical term, and it also can give a number to a term. Like the meaning of the prefix uni, U-N-I, unilateral means one side of the body. And then the prefix bi means two sides. The word bilateral means two sides of the body. Very important to understand how prefixes can expand the meaning of medical terms. In addition to giving numbers to the medical term, it can also describe a situation. Take a look at these three examples. Perinatal. That prefix P-E-R-I means around. Okay, so with the root word natal, now perinatal means around the time of birth. Epi, the prefix epi means above, and you combine it with the root word gastric. Now we have epigastric, which means above the stomach. Prefix hypo, H-Y-P-O, and the root word gastric. Okay. Now this particular word prefix with the root word here, the hypogastric now means below the stomach. Prefixes can also describe a size. Alright, this prefix micro attached to the root word cyte. Microcyte means small red blood cell. Okay? Well, what does cyte mean? Yeah, that cyte, you're going to have to understand what these combining forms, the root words mean as well. Okay? Cyte means red blood cell. When you combine the prefix there, it expands the meaning of red blood cell to say small red blood cell. The second word there, underneath microcyte, is macrocyte, which means large red blood cell. So as you see, it's not that difficult learning these medical terms if you're able to identify the parts of the medical term and build up and pare it down so you can have a strong understanding of what the medical terms mean.
This report, and it's 6 months late.
It's dumb. I had a drink with an ex. Tim found out. He grabbed my arm. He shook me a little. My sister overreacted.
Is that what he said?
I can handle Tim. He walks through the door. His mood, it's like waves coming off him. I know right away if it's going to be a bad night.
I said you take care of yourself. What about me? Did Tim ever have a bad night with it?
Tim would never. When he was born, he fell in love. Ken, he tries to be all tough, but in the delivery room, he was bawling.
Is that what Allie said? Or that I heard her?
Well, no one's making any accusations, but we have this report from Buffalo.
It's a misunderstanding. There were no charges.
Still, I'd like to get your side.
Alright, time for a review. Alright, I want you to identify the prefixes and suffixes of the following word, perinatal. Okay? Let's begin with the suffix, al. The suffix al means what? Means pertaining to. Let's go to the prefix next, which is peri. And the prefix peri means what? Means around. Okay? The root word. The root word in this word perinatal is nat. Okay? And nat means birth. Now, what does this word that has a suffix, a prefix, and a root word mean together? Perinatal, what does that mean? Around the time of birth.
My side is her bitch sister hates me.
Okay?
I see the way they look at me. The two of them, brother or sister. Because the dad left, they hate all men.
Well, that's gotta be frustrating.
I love Allie. She knows it.
Still, people you love can make you angry. Especially people you love.
I apologized. I was on my knees.
So is that what happens? Get angry and then do things you regret?
I want to talk to Al. What are you guys putting in her head?
Just sit tight.
We might have a lead on the car. Amanda and Alta Willis have it a bridge.
Alright, one more review before we move on to the second part of word analysis and deconstruction. So this particular word here is hypogastric. Okay, following the same process, let's begin with the suffix. What is the suffix? IC is the suffix, okay, means what? The suffix IC means pertaining to. The prefix next is hypo. Hypo means what? Means below. In this particular word, hypogastric, okay, because the combining the root word begins with a consonant, okay, and it ends in a consonant, so there means there's no need of a combining vowel, okay? So prefix hypo means below. Gastr is the root word meaning stomach. So the word here, hypogastric, means what? Means below the stomach. Alright, so we are at lesson 2 of chapter 1, which is word analysis and deconstruction. So learners, by the end of this lesson, you will be able to break down or deconstruct a medical term into its elements. You're going to be able to use word analysis to help ensure the precise use of medical terms. The third learning outcome for this lesson 2 will be use the word element to analyze and determine the meaning of the term. And the fourth and final outcome of learning 2 would be apply the correct pronunciation to medical terms.
They both come to a point where they're just not feeling that much.
This is the beautiful part of identifying medical terms and understanding medical language. Is when you see an unfamiliar medical term, the first thing you want to do is identify the suffix. So for this example, we have cardiologist here. The suffix is Logist. This means one who studies and is a specialist in. Okay? That is the suffix. Begin with the suffix and then apply it to the root word. Okay? In this example, the root word also has a combining vowel, O, because the suffix begins with a consonant, the letter L. So in this particular example, cardiologist, cardio is the combining form for heart, and so the word cardiologist means one who studies and is a specialist in the study of the heart.
Switch to Vonage home phone service, and you just might be surprised at what you get. Like unlimited or international calling for an unexpectedly low price, and over 25 knock-your-socks-off calling features. Plus, for a limited time, get our free whole house kit, a Vonage adapter, and 3 phones. A jaw-dropping
Let's take a look at this word here, myocardial. Okay, myocardial. This particular word, we're going to follow our process. We're going to look at the suffix of the word, which is AL. The suffix AL means pertaining to. The root word here is MY, okay? MY/O, which is a combining vowel, okay? MY/O is the combining form for muscle. And you have the root, which is cardi, which means heart. So this particular word, myocardial, means pertaining to the muscle layer of the heart. Myocardial means pertaining to the muscle layer of the heart. Do you see how simple it is when you're able to break down the word, beginning with the suffix, going to the beginning of the word to see if there's a prefix? If there's no prefix, then you go right to identifying the root word as a root word and
satisfaction.
Did you know Summer's Eve cleansing wash is pH balanced and gentler than soap, which makes it perfectly formulated for a woman's need?
Huh?
Did you know you're using it? That was close.
16 hours since the baby was reported missing. No leads. I'm not feeling happy. CSU come up with anything in the car?
Aside from the broken window, there's no sign of foul play. There's no blood in the backseat, no blood in the trunk.
What about prints? No hits. The only prints on the steering wheel were Tim's. Okay, so either the car thief wore gloves or I just didn't go down the way they say. Keep talking.
You have some news?
Police dropped your car.
Oh, well, that's good, isn't it?
Yes, no. We didn't find it.
here we have a word that's pronounced cardiomyopathy. Cardiomyopathy. Please don't let the length of the word or the amount of syllables in the word discourage you. You are able to So let's, since we have identified how to break down the words, build up the words, break them down, identify the parts of the word with suffix, root words, combining vowels and combining forms, in addition to prefixes, we must understand that correct pronunciation of medical terms is essential so that other health professionals can understand what you're saying. Okay? It is also important, very important component in ensuring patient safety along with providing high-quality patient care. Please understand, an error in pronunciation or spelling of a medical term can dramatically change its meaning. Okay? Please be sure you correctly spell and pronounce medical terms. This is why each day during class we will begin our lesson with what I like to call an assignment. An assignment basically is reviewing what we learned yesterday, okay, in addition to your practice, outside school practice of 3 hours, okay, to be prepared for your assignment each day, okay? So please understand, you also have a resource here with this textbook that will assist you in correct pronunciation by spelling the word out phonetically. Phonetically, what does that mean, Coach? Phonetically means spelling the word how it sounds. And this is okay that you spell the word how it sounds first, and then look back and apply the correct spelling from the textbook. When you are learning how to spell phonetically, you're allowing yourself to hear correct pronunciation. You are able to go to Connect Plus, which is located at www.mcgrawhillconnect.com. I want you to understand you must continually practice saying the word aloud with your study group to become comfortable with its pronunciation. Continuing on discussing pronunciation, I know for a lot of us, some of us are frightened that we don't want to look like we don't know what we're talking about when we're trying to pronunciate these words, especially when we know when some words are pronounced the same but are spelled differently. With that, they also have very different meanings. So take a look at these two words here on the slide, ilium and ilium. They are both pronounced ilium, but they both are spelled differently. The first one is spelled I-L-I-U-M. This is a bone in the pelvis. Okay? The next word, spelled I-L-E-U-M, is a segment of the small intestine. We understand life is difficult when two words that are pronounced the same are spelled differently and have different meanings. That's why it's important that you are able to listen well and apply what you're listening to the proper context of what and where you are applying patient care. Continuing on with pronunciation, there are some words that sound the same if incorrectly pronounced. So an error in pronunciation or spelling of a medical term can dramatically change its meaning. For quality patient care and safety, you must be sure you correctly spell and pronounce medical terms. Okay? Emphasis on the correct part of the word can give the precise meaning more clarity. For example, we have two words here, prostate and prostrate. The term prostate refers to the gland at the base of the male bladder. Prostate. This refers to the gland at the base of the male bladder. The next term is prostrate. This is pronounced prostrate. This means to be physically weak or exhausted or to lie flat on the ground. Okay? So understand, you want to be able to put emphasis on the correct part of the word so you can give the precise meaning more clarity. Okay? The patient, we have a 50-year-old male patient that is coming in for follow-up because his PSA antigen test was above the normal range. Okay? So we understand that this patient is getting tested for his prostate, okay, which is referring to the gland at the base of the male bladder.
Where are we with the parents? Something happened between Buffalo and here, but I don't make it.
Remember where we say our medical terms come from, their origins come from, is Greek and Latin. When we're talking about plural endings in the English language, a lot of times we're able to add s, okay? But plural forms of medical terms are based on Latin and Greek languages. So adding an s to many medical terms does not make the word plural or having more than one. I have to say that this particular time, student, you must memorize the plurals of medical terms. So, to help with understanding or to help with memorizing the plural terms of words, I would create a chart that has all of the plural meanings of all the words that you come across in all of the different body systems, okay? Because you must memorize them to the best of your ability. So by organizing them, separating the plurals from the singular words will help out tremendously.
Tempur-Pedic is the best thing in our house, except for my husband.
Here is you purchased this book for your learning. Refer to table 1.1 on page 12 so you can identify the singular endings versus the plural endings. So you have the example here, axilla. Okay, you see A is the end of the word there, singular. Okay, axilla. And then beneath that you have axilla, which they add AE to the end of the word axilla, okay, which gives it plural meaning. The next word there below is diagnosis. The singular ending is the suffix IS. The plural meaning is ES added to the word. So you have diagnosis is the singular ending IS, and then you have diagnoses, which ends in the suffix or the plural ending of ES. Remember, you must memorize the plural form of each ending. Please understand, altering the pronunciation or changing the pronunciation or spelling of a word can dramatically change the meaning. Now, we understand that many medical terms sound the same. So therefore, precise spelling and pronunciation must be clearly differentiated, okay? So as you see there, that word differentiated that I want to say, right, sometimes you just have to go through it, mess it up when you're pronunciating it, trying to pronunciate it the first time. Then once you get it wrong, right, go back and correct it. Okay, the person that's listening to you, chances are going to understand what you're saying, but it's the effort that you're going through that matters. Okay? Understand, a misspelling or mispronunciation can also alter the treatment. Change the treatment as well as the medication prescribed to a patient, which could result in injury or death. And we do not want that to happen.
SafeLight does things other auto glass companies don't. In the factory, high-tech robotics installed your original windshield.
Here's an example of words that needs to be spelled correctly as well as pronounced correctly. These two particular words are talking about blood pressure, but these two prefixes are totally different. When we say hypotension, this means low blood pressure, and when we say hypertension, this means high blood pressure. So please understand how important it is when you are pronunciating the word so that the treatment can be what is needed for the patient. A treatment response to the different meanings could cause a medical error and perhaps the death of a patient. Hypotension is low blood pressure. Hypertension is high blood pressure. So you want to practice your pronunciation, okay, along with the system of phonetic spelling that is accompanied in the textbook. With hearing the word pronounced, at www.mhhe.com/Allen ESS2E. Okay? So, you want to be able to do this, practice, practice, practice. Okay? So, as a health professional, precision in spelling and pronunciation are vital in your roles of direct and indirect patient care. Okay? You as a healthcare professional require the utmost attention to detail and precision, as I said, both in written documentation and verbal communication. Please understand, a patient's life can be in your hands. Your loved one, okay, could be in your hands. By you understanding what the healthcare providers are speaking of is going to help you provide better care for your loved ones and better care for the patients you are taking care of. Any incorrect spelling can reflect badly on the whole healthcare team. Any incorrect pronunciation and spelling can reflect badly on you as a health professional as well. So please put high attention to detail and effort in practicing your skills of knowing your suffixes, your root words, along with your prefixes.
You would have found him by now.
Alright, so to understand medical language, the student, you must first become familiar with the elements of medical terms. So what is a prefix? A prefix is the beginning of some words. And please understand that not all words have prefixes, and some words simply begin with the root. Remember, roots provide the core meaning of medical terms. And roots are often joined to other elements in the medical term by placing a combining vowel on the end of the root. So again, the root is the foundation of the word, and it is the base of the word, which gives the meaning its word. So now, what is a suffix? A suffix is a group of letters attached to the end of the word that changes the meaning of the word. Please understand, adding a suffix or a prefix to a root can build new words with different meanings. Precision in communication is vitally important. So this concludes Chapter 1 of Analyzing Medical Terminology, medical words, okay, which are essential in the foundation of medical language and the foundation of every healthcare professional's core, okay? I look forward to answering your questions, identifying your strengths, and identifying your weaknesses. Okay? I hope this was helpful and beneficial to you, and I look forward to reading your questions and comments in our group chat.